without further ado, let's bring on this morning's guest, the CEO of the Bermuda Health Council, Dr. Ricky Brathwaite. Hello, sir.
Good morning, folks. In honor of Weirdos Day, I will say it is never weird to wear a mask. How about that?
Well, I love that.
After that cough that she just gave, you had the right idea.
I know, right?
You had the right idea. Carla, it's okay. We still love you. But Dr. Brathwaite, thank you for taking the time to come on and have a conversation, especially it's the year that we've been having from a healthcare perspective. It's definitely a tough one, but let's just jump right into the conversation. What exactly is the Bermuda Health Council? What do you do? What's the purpose of the Health Council?
So I think the original purpose was to bring together experts in health to help to direct where the health system is going, to ensure that people get the best care, that the providers, the doctors and nurses get the best support, that we are able to advise the Ministry of Health on what needs to be done in the health system. So the Health Council was actually formed as one of the ways to help the health system to improve. And that's what we've been doing. We've been doing a lot of different projects on trying to help the health system to improve and ultimately to get people better health.
Dr. Brathwaite, how has the Health Council helped support the community during the pandemic?
So we have been leading the charge around the care homes. I know the care homes with the vulnerable populations, we looked at how to best protect them. We've also put out, as you probably heard about, Health IQ. Health IQ is one of the tools that's being used to capture information on how people are doing. It's also being used or has been used in terms of the opening back of the economy to see how safe we are. We are still tracking lower than expected when it comes to wearing masks and physical distancing. So it's something that we're always tracking. And in general, we're advising the ministry on things that we're seeing within the community, hotspots, risk, and we're involved in a lot of the meetings that take place in terms of the planning for COVID response.
So you talked about social distancing, and with Bermuda having such low numbers, it kind of gives a false sense of security. What do you think is the challenge in that? In the proof right now is that the numbers are low, but yet it's still very important to wear a mask.
Yeah, so
I social distance.
Right. So I think we have proof in other places, right? This is a new virus. This hasn't been seen before, but we have a lot of proof in a lot of the other countries where it only takes one person. Only takes one person to come into a crowded room, that virus to be spread to that room, that virus to then leave that room and be spread to different homes where people come from. So we understand that this virus is dangerous. We can't take it for granted. We can't say that we're safe. Like when everyone's calling for safety, that's when the things happen. That's when the outbreaks happen. So we have to be very careful that remembering that it only takes one. So we have to protect both ourselves and those around us so that we're not the one who spreads a virus that we think that we have come to believe that we're safe from. So that's an important message that it only takes one.
Now, much has been said about COVID impacting those with existing conditions more than those without. How can Bermuda use this as a time to promote a healthier population?
Man, I to be honest, I wish we didn't have to wait until now. Our chronic disease conditions have been growing over time. It's been highlighted during COVID, where we know that those who have multiple chronic disease, comorbidities, those who have a little deficit in health are most at risk for, complications from COVID. I really wish that we didn't have to wait till now, but this is a great opportunity to spread the message that get your health. Let's get our health together. And it's not just about personal responsibility. It's about also the community coming together and helping each other to improve our health, putting together programs. So one of the things the Health Council does is we promote a innovation fund where we believe that if a person within the community has ideas on how to improve community health, we have money to help to fund those programs. And so we're always soliciting and saying, hey, if you have good ideas for people within your community to improve their health, to change lifestyle, we're more than happy to put some funding and some money behind it.
No, we've asked this question at least 3 times during our run of our show, and it keeps getting avoided. Let's see if you can answer for us. Mm-hmm. What is the Health Council's position on a private insurance company purchasing a medical practice?
So there's probably two answers to that question. The first is that there is, so a health insurer by itself is not allowed to enter into non-health insurance business. You're talking specifically about a deal that went down with Argus. It was done a little differently. It was not done through their health insurance arm. So from a legal standpoint, there's nothing that we can say in terms of it couldn't be done. In terms of the ability of or the value of it, we believe that we do have a fragmented system. We believe that any efforts to consolidate and bring that system where people work better together is good. It would have been helpful for the players involved in that deal to at least discuss that, because there are a lot of different changes going on within the health system. So how does this fit into the long range plans of healthcare reform is an important question, and no one asked that question. And so we were a little disappointed that the questions weren't asked, because there is a plan, and if this doesn't fit into a plan, then it becomes a failure, and we don't want anything within the health system to fail if it has to do with improving health of the residents of Bermuda.
Okay. If you have any questions for Dr. Brathwaite, feel free to send them through. It looks like someone asked the exact same thing that
Right.
Carla did, just asking, what do you think the pros and cons of this merger are?
All right. So maybe I can dig into it a little more. So the possible pros of such a deal are consistent standards. So how we practice medicine, the standards that are within that kind of system, how everything can be standardized in a way that can be helpful to patients. The cons of it is in some ways the same thing. If you have someone outside of the healthcare system kind of directing physicians how to practice medicine and doing it based on business decisions, that can be a problem. So if Argus or any company can support doctors to do their job in the best way possible, that's a good thing. They come as they intervene in a bad way, then it's the problem.
Gotcha.
So everyone has been talking about this for years, like healthcare and like everything else in Bermuda is so expensive. Right. But it's becoming where people are making a choice sometimes between insurance and groceries, for example. Do you think it'll ever become a time, keeping in the context of Bermuda's expensiveness, that healthcare would ever go down or be more affordable? Or is this just something that we, those who live in Bermuda, will just have to deal with for the rest of our lives?
So I doubt healthcare will ever be as inexpensive as, let's say, in Jamaica, where healthcare is pretty inexpensive. The government puts a lot of money into it, but the cost per each of the patients is low. We're in a really difficult time right now. We have a lot of people who are uninsured due to COVID and the unemployment, which leaves less people to contribute to the cost of healthcare, contribute to the cost of running a medical practice, contribute to the cost of running a hospital. So right now we're actually in a pretty tough position where it actually may become more expensive for some individuals because there's less people in the pot per se who are able to pay for healthcare. But we still need to make sure that people receive healthcare. So in the long term, we are looking at kind of the Bermuda Health Plan as a way to right size the system, as a way to become more efficient, as a way to do things cheaper. So we have to pay very special attention to how to reduce the cost of delivering healthcare. That includes how to receive supplies for cheaper here in Bermuda, how to use people in a more effective way. On the other end, on top of trying to reduce costs, we also have to get people healthier. The healthier you are, the less resources within healthcare you have to use, and less we have to contribute to kind of keeping the health system running. So it's a tough proposition, especially now with COVID and the change in the economy has made things a lot more difficult. But we're all dedicated, and I think the ministry, community providers, the Health Council, we're all dedicated, and I believe the public itself, all dedicated to make this work and come together as a collaborative to make this work.
I want to go on the back of what you just said, because I think when it comes to healthcare, you literally, and I can't wait to edit this show and take that clip of what you just said. you said what really should be the focus of our conversations normally when it comes to health. And we should have more of a focus on our physical health and our mental health than we should the cost of healthcare. Because
Right.
if we take better care of ourselves, then there would be a reduction in the need for healthcare, right? So I say that because I look at the pandemic and it's so much of the focus is on, you know, who's getting the disease, and those with existing conditions are usually the ones who are hit worse. But for me, what's been missed is the opportunity to promote a better lifestyle, a healthier lifestyle, eating better,
Right.
taking a, being more active. I think that's all being missed, and I think it's a perfect opportunity, especially within our community, for us to really take control of our lives. I don't share my diet information or anything so that people can live like me, because like I said, I love potato chips and French fries. But little changes that we can do. And you just said it, little things we can do, focus on our actual health, and the cost of healthcare actually would respond to that. No.
Right. No, that is exactly true. I mean, I know that there's been kind of a sense of trying to be outside more often, try to get on bikes more often. So I think people have been paying a lot of attention, especially when everyone was in shelter in place. How do we do a little more things outside? How do we become more active? The gyms were closed for a while, which took away some people's opportunity, but people started becoming creative. So we have to take the momentum of people being creative and doing things in a more active way. Then we also have to introduce better foods, better eating of foods. I know that there is I believe it's a drive-in or drive-through kind of vegan festival coming up, I believe in October or so. And those kind of activities, we have to expose people to eating better and being more active. And we have to do it more as a community. Again, peer pressure sometimes is a good thing. Walking in groups, riding bikes in groups, getting our kids outside to play. We have to return in some ways back to days before I was born, when things were more outside and communal, and people just enjoyed being outside and laughing and enjoying fresh air and swimming and so forth. So those are the kind of things that we have to focus on. You're right. Instead of trying to figure out how to fund healthcare as much, more focus on how to become healthier as a nation, as a population, as a community, as a family, and as individuals.
Indeed. And I'm gonna put Carla on the spot. Like, Carla goes to the gym now, that she shared with our audience. And for instance, before well, and that's a good thing. But before this show, you could not pay me to run outdoors. But my gym has been closed since March, and so I had no other choice. Am I as active? Probably not. But it's something that keeps me going, at least for the time being. I haven't been as creative as most people. I mean, the internet, people make me seem lazy, right? But that's a good thing, because it still gives me something to aspire to. We got some questions for you, though. A lot of. I mean, you're a popular person, Dr. Brathwaite.
Well, can I touch on what you said just now? Like, just by you running outside, somebody sees you and someone gets motivated to do the same, and that's important, right?
So, you saying that, before we go to the next question, because a certain someone who I am legally contracted and married to likes to pull me on the carpet in front of her friends, right? So I used to have this issue. The issue was, if I went to the gym and there was someone next to me, a lady, and she was on a treadmill, for instance, and she was going a certain speed, I had to go a speed faster than that person. My wife loves telling this story to people, right? But I used that because I was literally motivated by anyone who was next to me, but especially a woman, until I realized, Jamel, you just cannot
outrun her.
Yeah, like that. This person is probably a marathon runner, just taking it light today. But you're right. Seeing other people do stuff is motivating to me.
Right.
It really is. Question from Charlene Gilbert: what is the council's position on medical marijuana?
So I believe that there's a place for medical marijuana. I think there's enough evidence to point that there is a place for medical marijuana within the market. It has to be regulated. It has to be controlled. It has to be based on science. Actually, my best friend actually runs a medical marijuana lab in the States. And so he produces medical marijuana products. And he does say, one of the things that he did say recently is that 80% of the people who do receive prescriptions for medical marijuana are actually using it for recreational purposes. So we have to be careful that if we're going to call it medical marijuana, or we're going to use it as we're using it for medical reasons, that we're actually doing that. If we're not, if we're just using it for recreational reasons, then we need to have that conversation and be honest with ourselves. But, I think in terms of some of the disorders out there, a lot of the neuropsychological disorders out there, it has been proven that there is some benefit to medical marijuana, the use of. We're not talking about just regular weed. We are talking about things that have been manufactured in a lab and extracted the right way and of the proper quality and so forth. So I don't think there's any problem with medical marijuana as long as it's the right and it's the good quality.
My former colleague once said on the radio, this was about 12 years ago, a guy called in and he said, just legalize it. It helps people with this. It helps people with that. And so my colleague says, look, let's just be honest. Yes, there are medicinal benefits, but if you just want to get high, just say that. Don't use one thing. And he's right. There's a difference. And for me, I've been very public in my stance. I was very against the idea of legalization of cannabis, and then that changed over the years for various reasons. So, not for personal use, folks. Don't jump to the conclusions.
Yeah.
Please don't. Seriously. Terry Cool writes, lifestyle changes are necessary. I did a plant-based diet and shifted my thyroid issue on its head. You mentioned a vegan festival coming up. One of the things that I've noticed, because I do eat a lot of vegan products, I stopped doing the dairy thing about 2 years ago. But saying that, not all vegan diets are healthy, right?
Agreed. Chips are a vegan diet.
You just had to remind me.
Right. But you're absolutely right. I mean, not all diets are equal. I think one of the things that are important, and I think we've tried to become more integrated in the way that we think about it. There are people who study these things. There are people who are professionals in these areas that, especially for those with chronic conditions who are looking to change their diet, they should lean on some of the experts to help them gain a balanced diet and a diet that's right for them. Just going vegan and even eating avocados and avocados and pears and eating potato chips every day may not be any better than eating meat and dairy, right? So we have to be very careful that we're actually using some kind of basis for the diets that we choose, and it's right for our bodies. Which also brings us back to healthcare, right? If we're using healthcare in the right ways, we should be getting more of that kind of advice on how to improve our behaviors and our diets versus, I just had this heart attack. Can you fix it? We should be more preventive on the front end side than anything else.
I always say, from a personal perspective, I kind of shared that I had issues with certain types of charity. And some of those charities were, I'll be specific. So let's say school's going back in.
Mm-hmm.
So we would have these, backpack giveaways and giving clothes and giving food. And so one of the issues I would have is I would ask myself, how is this being measured, right? So if we're giving Carla and Dr. Brathwaite a backpack for school this year, and they come back next year again, and they need a backpack and food and clothes again, then to me, that's not helping them. And that's what I look at when it comes to healthcare. If you go to the doctor today and they say, hey, you're pre-diabetic, the next time you go to that doctor, you shouldn't be diabetic. They should have, it should have been a conversation on how to get you to, do better and avoid what was to come next. So that's how I look at what you just explained. I think we have to look at improving by the next visit rather than going back, like you said, to fix the heart attack.
Yeah. Go ahead.
No, I'm sorry. I was just going to say, because that's an actual question, and I see it's been asked a couple of times. But then how do you counteract that? Because many of us, I'm in the UK, mind you, but where it's much, much cheaper to eat. But in the Bermuda context, you have people who want to eat healthier, but then a head of lettuce is $10, $12. I mean, I might be exaggerating, but things are so expensive. So then again, how do you get healthy when it just seems like it's so expensive to do better for your benefit that will then not worry about the back end, which is the health insurance?
Right. And that always in some ways blows my mind, maybe the argument, because health insurance is $1,000 a month. Right. So the $10 piece of lettuce is an investment in yourself in the same way that health insurance is an investment in yourself. But we want to get to a point where we're raising an investment in the things that personally improve our health versus investing in the things that help us when our health goes bad. Right. So I think we do need to switch the paradigm into more investment in our lifestyle, more investment in our diet, more investment in our mental health, those kind of things, and reduce over time the investment in the protection of the catastrophe. So I think it's just a matter of the mindset of as to where your money is going. So if it means buying a $10 head of lettuce every day that will allow you to reduce your health insurance, then I would buy the $10 head of lettuce every day because over the long term, you'll save a lot of money.
And I think, I mean, I had a conversation to someone recently. It obviously takes more effort and work. And if you have children and family and other responsibilities, you probably don't necessarily have the time. But a lot of people are starting to do their own garden and even find a little pot or so on. So there are many options. Again, that takes a lot of time. Let's go to a few more callers. Still that latest healthy food is extremely expensive.
I was thinking it when he said it earlier. Doctor said it earlier because I hear that all the time. So
Terry says plant-based equals nutrient rich, being conscious of the ingredients, fresh fruits and veggies. Here we go. Robert Durham says, is this why FA is paying insurance of those who don't have it? FA is financial assistance, I believe. So there's more money to put in pot to prevent insurance prices from rising.
So financial assistance is actually paying for health insurance for those who are on financial assistance so that they can have health insurance. Otherwise, they wouldn't be covered for going to the doctor or going to the hospital, and they'd get a bill. So that's the only reason why financial assistance is paying for health insurance. If I got the question right, it's not about putting more money into the pot. It's actually just for the minimal coverage for those who have financial assistance.
Gotcha. And we have another one. Srinath Bridge says there's a constant battle between the cost of healthy eating and what's affordable, a vicious cycle creating a challenge for the messages being put out to the BHC to live a healthier lifestyle.
Yeah, so that's always a battle, the cost of healthcare, and having, there has to be a conversation about the cost because the cost affects so many people. I think when you're talking about the top concerns around the election, the cost of healthcare, especially for seniors, and maybe not just for seniors, but across the board is a major concern. So we have to have that conversation, and sometimes it drowns out the conversation around healthy lifestyles and doing those kind of things. I mean, I think research has pointed to the fact that healthy outcomes or your ability to be healthy is only impacted 10 to 20% by receiving health care. Right. The other things are around, your genetics, your behaviors and lifestyle, your diet. Those kind of things actually play a much bigger role in whether you end up healthy or not than whether you use the healthcare system. So we have to take some of this into consideration as to how we spend our money and what we prioritize.
Indeed. And I did have a question. I saw in the comments, someone actually asked something regarding it, but here we go. Sean Smith says, is Bermuda moving towards a national healthcare system, or is it going to remain as is? So I think that was a question I think Carlo or Shari Lynn asked the candidate from the OBA who came yesterday, Catherine Kemp, about the whole universal healthcare thing going on.
Yeah, so Bermuda is not moving towards a national healthcare system. So a national healthcare system would be a single system where everyone's just under one single insurance that's run by the government and paid through taxation and so forth. So we're not moving towards that kind of national healthcare system. We are moving towards a system that is more efficient, that takes care of the vulnerable in a better way and gives them more comprehensive care, that gives people more access to affordable medications. But we're also looking to ensure that we also have a healthy private health insurance market as well. So this notion of a nationalized single healthcare system that covers everyone, like the NHS or some of the other countries out there, we're not looking to move to that kind of system, but we're also not looking to stay where we are, because we've seen, and COVID has been a prime example of how our health system needs improvement because of the fragmentation of it. And we've seen that a lot during COVID and the response and being able to provide care for people. We've seen that there's a lot of gaps in our system. So we need to improve it, but we don't need to go to a national healthcare system, much like the NHS.
Alrighty, and just one last question. According to the website, the Health Council last had a strategy plan from 2009 to 2012. When can the public expect a new plan, and what will we find in that plan?
Yeah, so from the Health Council, we did have a strategy, and unfortunately it hasn't been posted, but we did have a strategy session in beginning of 2019 that went through 2022. So we do have a 3-year plan. It includes things like reducing the costs of medications or regulating the price that prescription drugs are sold to the public. It includes things such as kind of the Bermuda Health Plan or financing reform, so we can try to move things to be a little more affordable, especially for those who can't afford the high cost of healthcare. It includes looking at the benefits that are provided, providing more prevention. And then it looks for things like regulation of health professionals in a more efficient way so that we have high standards for everyone. We want to make sure that we are giving enough resources to our health professionals to provide care in the way that they believe is the best. And sometimes it requires support. And we're part of our strategy is to provide as much support as possible and to also promote innovation and progress. We are in 2020, and some of the processes that we use are still paper-based. We're wasting a lot of paper. We're not sharing information in the way we can. So the Health Council is working in ways to try to get people to share more information and work better together. So those kind of things are all part of our strategy. And what I will do is I will promise to make sure that is updated on our website. We often are pretty busy, so sometimes some of that gets overlooked. But we do have a strategy that was put into place in 2019.
All righty. So we'll be looking forward to that. Dr. Brathwaite, thank you so much for taking the time and trusting us to have this conversation and engaging with the audience. Please know that these kinds of conversations are needed, and the door is very well open for you to come back and do this again.
Nothing weird about wearing a mask, right?
Absolutely not.
I love it.
Yeah.
Wear your mask.
I will be a weirdo as long as if it's about wearing a mask. I'll be as weird as I can be.
I'll be sure to have mine on next time you come back. Thanks.
Right. Be safe, Bermuda, and thank you guys.
Have a great day.
You too.